Yes, it is time for our Health Watch. We are joined by our buddy Dr. Syed Hussain of Trinity Health of New England. Good morning and welcome back.
Morning, thank you.
So we have a lot to get to this morning. First off, we want to talk about seasonal depression. It's starting to get darker earlier, I've noticed, and that can start to lead to some changes in people. So what should people be on the lookout for?
Yeah, great question, Symphony, because there are things people can do, especially if they know they've encountered some seasonal affective disorder symptoms, SAD. Some may have a milder version known as winter blues. Actually, 10 to 20% of U.S. adults may suffer from winter blues. Basically, what this is a constellation of symptoms, which include feeling down, feeling sad, lack of energy, a lack of interest in activities that previously interested you. So all of those come together is this disorder. And first things first, make sure you see a healthcare provider. Make sure you get the adequate diagnosis. We want to make sure you don't have any underlying medical conditions, thyroid, for instance. All of those are ruled out. And indeed, you do fit the definition of seasonal affective disorder. What can you do? So, stick to a timetable of activities, for instance. Go to the gym a few times a week. Light therapy is known to be of benefit in people who experience this disorder. So, speak to your healthcare provider. There's a special type of light, usually used in the daytime, in the mornings, which can help reset that biological clock, for instance. There are medications. There's talk therapy, known as cognitive behavioral therapy, which may be helpful as well. Probably seen in studies to be most helpful. So there's a number of things that folks can do, but this is the time now to start getting in touch with your healthcare provider, especially if you've had this condition in the past.
Yes, I've dealt with it myself since moving here. You guys know that I came from down south, but we didn't have these intense winters with several months of it being gloomy outside. So I know now I make myself bundle up and go outside for a short walk, even if it's 30 minutes.
Or talk to someone, talk to a friend or a loved one. Yeah. All of those help.
Good to know.
Yes.
Already up next, as the seasons change, people are dealing with asthma flare-ups, right?
That's right. So this is a good segue into asthma, especially if you have diagnosed asthma that is triggered by allergies, for instance. So pollen we see in the fall, or dander. If you know what the triggers are, it's a little bit easier because you can take steps to avoid them. For instance, if you're allergic to pollen, maybe it's not the best time to go out into the lawn, mow your lawn, do the grass, have someone else do that for you. And if you know dander, for instance, is something that will trigger your asthma, then stay away from animals, for instance. Now, if you are experiencing difficulty breathing, wheezing, runny nose, itchy eyes, first time this is happening, make sure you see a healthcare provider, because there's a certain number of tests that the doctor may prescribe, which will then diagnose you with allergic asthma, and will include testing for allergens so that we could hone in on what exactly is the trigger. There's rescue medication available as well, rescue inhalers, but important point for viewers to remember: if your symptoms do not improve, if you're taking a rescue inhaler, if you're still having difficulty breathing, wheezing, don't hesitate to call 911 or go to the nearest emergency medicine department.
Okay. All right. Now we have one more to talk about before we wrap up. There's a report out saying that there's something called kissing bug disease spreading across the country right now. What is it and how does it affect folks?
Yeah, I don't want viewers to get alarmed. This is a disease that's been there. It's endemic, which means it's prevalent in 21 or more countries right now across the globe. It's also present here in the U.S., mostly in the southern part of the country where it's a little bit warmer. Okay. It's a parasite, Trypanosoma cruzi, that is carried by a bug called the kissing bug. The bug may bite a human being and actually defecate into that bite, which then, inadvertently, we may, try to scratch ourselves and then take put our fingers in our mouth, etc. That's the mode of transmission. And it can lead to fatigue, rash, not feeling well initially. But in some certain people can actually have very severe consequences impacting the heart. So it's really, really important that the reason why this designation is important is because it will lead to more awareness with providers, but also public health policy around this disease and how we manage it. There are medications to treat this disease earlier on in the process.
All right. Well, thank you so much for joining us.
Sure.